Yeah, got critical. We are live. Hello, everyone. Hello, hello, hello. Thank you so much for joining. I am so excited to be back. My name is Yolanda Givens, and I am the host of the Doty Report. The Doty Report is a health awareness, health promotion show. This is our sixth season and we started out on Can TV. So this is a new platform. I'm very excited. The organization has been around for, I want to say 20 years, have been a strong advocate, healthcare advocate in the community across the Chicagoland, bringing in resources and information and education to the community. The whole premise for the organization is to help the community live healthier lives. So I am excited. We are back. I am. It's been a very hot day, so I know I'm looking like I'm hot. But thank you so much. We are going to have some great conversation. I have two amazing guests, and we have a lot to talk about. We have a lot to talk about. There's a lot going on in our city, in our country, and across the world. So I am pleased to be able to have two very highly recognized, amazing individuals that are doing some great work in Chicago and probably outside of Chicago, I'm sure, as it relates to just making a difference in the community. So we definitely want to bring them on. I always like to give a shout out to the CEO and founder of the Georgia Doty Comprehensive Health Organization, Mr. Don Doty, and his wife, Miss Joyce, and the entire board of directors. So I want to bring in my guests. I have two. I first, and I'm going to allow them to tell you about themselves a little bit more, and then we'll get into the conversation. I first have, ladies going to go first. I first have Miss Neli Vazquez Rowland. She is the co-founder and president of A Safe Haven. Um, Safe Haven is amazing. It's been around a long time. Recently, just recently was recognized in Cranes as one of a healthcare hero. And she told me, she said, I'm not a doctor or I'm not a nurse. So she is very proud to receive such a recognition. But the organization has received tons of recognition for the many years that they have been around and throughout the people that they're serving. One of the things I definitely like about this particular organization is that it has achieved the balance of that nonprofit and that for-profit social business and have done a great job at doing that. So thank you, Miss Rowland, for being on the show today. I can't wait to hear what you have to share with our viewers. Then we have Mr. Donald Booth, who has been the CEO, right, for 36 years. Is that correct?
Actually, CEO for 30 years and employed at HSI for 36.
Okay, so but you've been around a long time doing some great work. 4 decades that the organization has been around. HSI, is that correct?
That's correct.
That's correct. So we have a lot. I'm gonna give them both a couple of seconds, a couple of minutes to talk about themselves, and then I am going to get the conversation started with my first question. So, ladies first, you want to tell us a little bit about yourself?
Well, thank you, Yolanda, for that really beautiful, gracious introduction. Like Don, we've been in this business for a long, long time. And we both started when we were about 12, right, Don? Right? We started A Safe Haven. We're actually celebrating our 25-year anniversary this year.
Nice.
And yeah, believe it or not, we started out in 1994, just to kind of take you back to what was going on in 1994. My husband and I were actually in the field of finance, and we were blessed to have grown up in situations that could have gone south for both of us. Grew up in a poverty-stricken community, little village. Our high school, Farragut High School, had a very high dropout rate. And I was one of those people that was on track to be one of those statistics. So thank God for divine intervention, right? I mean, the right people appeared at the right time. and I was actually diverted to go to Jones Commercial, which people don't know about, but back in those days, we were taught vocational education, right? So I learned, I'd be a secretary. I learned business, and I went, out to college after that. So again, everything happens for a reason, and it just so happened to be located next to a homeless shelter, which introduced me to the idea that there were people that were homeless and living on the streets. Back in those days, it was right next to our high school. So to make a long story short, once life started to take a turn, in a very positive direction for us in the financial world, we decided we wanted to give back and make a difference. And in 1994, that's when we started really strengthening the laws against, people that were suffering from underlying issues like substance abuse issues. That crime bill we knew was going to be a bad situation for a lot of people that I knew who were suffering from substance abuse issues, and our family was affected by it. And it just opened our eyes that more needed to be done. And we started investing our own resources to building properties and buying businesses and finding a way to create a model that can help them, get them a roof over their head first and foremost and get them back on their feet. So that's a safe haven for you. Today we're celebrating 25 years, and it's a model that we're really proud of. It continues to help more people, and right now we're helping 5,000 people a year, and I know the need is much greater than us, and we have a lot of people in this world that support us and make our dream and the dream for people that we serve possible. So thank you for hosting me today.
Wow, thank you. So you are definitely a role model. Definitely a role model, and someone that young ladies, young women, and just everyone could definitely look up to and model after. So I want to say I appreciate that because it's so important, especially in today's time. Definitely important. Mrs.
And
Stewart,
also want to give a shout out to Don Doty before we move on.
yes,
For putting us all together. And his mom, who's watching over us.
absolutely.
Georgia. Mm-hmm.
Absolutely. Yes. So again, shout out to Don. Thanks for having us this evening. Yolanda, thank you so much for hosting this night as well. And of course, congratulations, Nelly. This was wonderful. I just have fond memories of driving by Jones Commercial, and just always thinking to myself, they always dress so sharp. They look like they're about business, and of course,
we were just in high school.
but you guys always look so sharp, And I was actually born and raised on the west side of Chicago, and I wanted to go to St. Philip's High School on the west side, but they were closing the year after I was graduating from 8th grade. So I decided I wanted to be a Spartan, and I traveled from the west side to the south side to Hells Franciscan High School. And that's why I always got a chance to ride past Jones Commercial and see what was going on with you guys, at least from the outside looking in. But again, it's my pleasure to be here this evening and talk a little bit about HSI. This month is actually my 30th year, celebrating my 30th year at HSI and as the CEO. And it was very interesting, and I think it's important that I begin with this story. Nelly, I don't think you had heard this particular story, but my predecessor, Larry Bird, had been running the agency for about 10 years. He came from Georgia, and he was very connected with the Clare Christian United Methodist Church, which was our predecessor. So HSI actually grew out of a community ministry, church ministry with Clare Christian, which is still very active on the west side of Chicago at 16th and Pulaski. And, Larry, unfortunately, died a very sudden death when he was only 39 years old. And, the agency was thrust into an emergency executive transition. I was asked to step up to the plate and, become the executive director. And, of course, as a social worker, as a clinician, I wasn't looking to do the administrative thing. I wasn't looking to be an executive director. In fact, I would always think that my job as a clinician was to reduce the stress that people were under and help persons like Larry Bird keep going with, sharing different stress management techniques with them. But I got that call. I stepped forward. And what was interesting was that, and by the way, I also went to the University of Illinois, Jane Addams College of Social Work, where I received my master's, and did my first year field placement at the Juvenile Court of Chicago, and my second year placement was done over at the Westside VA, now the Jesse Brown VA. So I really got a really good grounding, if you will, in clinical psychotherapeutic intervention. So by the time I got to HSI, 4 years out of graduate school, I was thrust into a major movement. And, for me, this is really what HSI has been about for its 40 plus years. We've always been responsive to community needs. So in coming to HSI, the biggest movement at that time was deinstitutionalization of people with disabilities. And, so my job was to become the case coordinator, and I coordinated that service, that function for 5 different agencies at that time. Bobby Wright Comprehensive Mental Health Center, NIA Comprehensive Center, Human Resources Development Institute, Abraham Lincoln Center, and Human Resource Development Institute. These organizations were really significant and historically, Black-led organizations. But again, the main thing was to get people with disabilities out of those institutions and into the community. So I can go on and on and on about that, but it seemed like every major thing that was happening in terms of challenges to our society and the African American community, it led to child welfare. But at one point in time, HSI was the largest African American managed child welfare agency in the state of Illinois, with over 500 children in substitute care and over 150 foster parents. We led the African welfare to work. Most recently, we were selected to help lead the census effort. And everyone knows how important the census is. So right now, we're coordinating outreach and engagement activities for 29 additional organizations. And they have been, our partnership has been fabulous. We made over 200,000 outreach calls, since we formed the organization. So we've always been responsive to community need. Always, at one point in time, Neli, we ran a homeless shelter through the city of Chicago, realized, as you did, that there were underlying causes to homelessness that we needed to address. So we converted it to a transitional shelter, and later on it became a halfway house because we really want to focus in on that particular issue. So, again, the thrust has always been, what is the most pressing community need, and how can we be responsive to that? That's what it's been about for us over the past 40 years.
Wow, that is amazing. Congratulations to the both of you, because the nonprofit world, or that world of community organizing and support, it's a challenge, for an organization to be able to sustain and be successful over and over and over again across the years. So congratulations to both of you. So,
I think that, the fact that they've been around so long, we've been around so long, says a lot about how battle tested we are. We have had everything thrown at us, but because of what's at stake, right? We don't give up and we don't quit, because what it means to the people that we represent. So I know, Don, what you've been through, and I know you know what we've been through, and it has not been easy, but thank God, we got through those times, and we're going to continue, because we have another tsunami hitting us right now with this pandemic that I think we're going to be talking about.
Right, which is what I wanted. You said it earlier, like our world is upside down.
Yeah.
Things are not the norm as we know them. We have all been challenged with it. I want to start by asking, how has your organization survived? How has your organization been affected? Your staff, and then how have you been able to support the people that you serve during these last several months? So either of you can go with that, to just begin to talk about what's been happening with your organization since we've been in stay-at-home, quarantine, pandemic, civil unrest, so much going on right now.
Go ahead, Don. I would love for you to start.
Well, my first comment is like, okay, so, it's our turn, to tackle the most significant issues of our day. As I look back historically at what has been going on in this country, especially, and let me just back up for a moment and say that, the message of Black Lives Matter really is not a new message.
Mm-hmm.
You know, with the census, I've been saying to folks, we were counted, when we got off the slave ships. We were counted when we were on the plantations. It's important that we count now. It's not a new message. I mean, the abolitionists were working with persons who were enslaved back in those days, saying, we count. During the civil rights movement, Martin Luther King and all of his colleagues were talking about the same thing. I am a man, I do count. Reverend Jesse Jackson, I am somebody. The National Association for the Advancement of Colored Folks saying, look, we deserve to be counted. I mean, it's been the same, most consistent message. So for me, after it's all said and done, after I look at generations of struggle, Neli, I say it's our turn. The struggle continues. What do we need to do to step up and continue to fight, for civil rights, for justice, for being treated with dignity and honor and respect? And, I was on a call with, a colleague, and I said to myself, to Bishop Porter, who's over 80 years old, I said, Bishop, you're 80 plus years old and you're still doing this work. I said, I got at least another 20 plus years to go. So, I mean, we just have to continue to fight and do what's right to lift up folks. And every time a curveball is thrown, and this all too well, Neli, somehow a way is made, for us to be able to get through that storm and see that rainbow and that hope and that possibility for a brighter future.
Wow, I like that idea of the rainbow, that hope, because I do think definitely a lot of people need to know that there is hope, and there is kind of the sunshine after the storm. Yeah. So, what about at A Safe Haven? How have you guys been impacted, or how have you been supporting the people that you serve?
Well, it was interesting. Like Don said, this is something that is not new to us in terms of, when I started out the conversation telling you about what we noticed back in 1994. My husband and I, we were just trying to write a check to a charity, and we decided that we wanted to give back specifically to people that were suffering with substance abuse issues, because we had dealt with that in our family. And we knew that if we didn't have access to the insurance and the resources and the support, that it's a very slippery slope that someone can go through overnight, right? So we knew that another thing that was happening in 1994 was HMOs were going public. And the first thing that they were doing is they were canceling that 28-day stay. So when you had substance abuse issues, and if you had insurance, you actually would be able to go to a hospital, stay there for 28 days, and then supposedly, get the treatment services and then get let out. But we both know, Don and I, from being in this business, that that's never enough. They need to have a place where they can actually engage and deal with their addiction, learn how to live in recovery, educational issues, employment issues, so many other things, sustainable housing that they have to deal with, right? That doesn't happen in a hospital. So we knew that by looking at what was happening with criminal justice reform, we knew what was happening with the insurance rule that was basically going from 28-day stay down to a detox in terms of coverage. And then after that, you're on your own. And knowing that the disease really came with the idea of recidivism was just a natural part of the disease, right? The relapse rate. So what we knew about the disease and what we knew what was happening in the world didn't add up. We're like, so basically what the world was telling us, that there's not any more insurance to cover you for behavioral health care issues. We're not going to treat it in the hospital because the data show that the relapse rate was too high and insurance companies were losing money, which was true because it was very disjointed and very siloed in the way they were dealing with it, only from a treatment perspective. Also, we saw the way criminal justice reform was happening, and that crimes bill was making it illegal for you to have a substance abuse issues, and now you were going to go to prison, right? So we're taking it out of the healthcare field and moving it into the prison field. And we were incentivizing states to build more prisons. And now we were looking at the pipeline of the third grade to prison pipeline. So for us, we were like mortified and just overwhelmed that this was happening, and no one was really looking at it from a holistic perspective and what this meant to people that came from communities that I grew up in, I grew up blocks away from Cook County Jail. So I can tell you, I know a lot of people that ended up in that system that, by the way, I didn't even know that there was treatment. Like, what is drug treatment? Like, my people ended up in the prison for those issues. So anyway, so we felt that, we knew too much to close our eyes and walk away. And because we were looking at the landscape of like charities, at the time, most organizations were really set up to either feed people or to house people overnight. Like the place that was next door, if you remember, to Jones Commercial, was an overnight shelter. I don't want to mention any names. And that was important to have, but we felt it wasn't enough, right? Someone who has these issues, they need to have a place where they can count on, that they can live and they can stay as long as it takes and get the right wraparound services to get them back on their feet, but that didn't exist. So Brian and I just decided, well, then if it needs to happen the way we think it needs to happen that aligns with our values, why don't we just go out and buy some buildings in some distressed communities where the homeless already are, right, in these abandoned buildings. Let's convert them into apartments, let's furnish them, and let's invite these people to come there and live there for free, as long as they follow the rules, and we'll hire some people to help them out. So we thought we would do this for about 3 months, and that would be the way that we would give back, but once you start helping people and you start to see that their lives start getting, put back together just because of a little thing that you did, we couldn't stop doing it. So believe it or not, we did this on our own time for 5 years. And we realized that this was a bigger problem than what we can do on our own. So we got a study by Northwestern that showed that our model, believe it or not, got published in the American Journal of Public Health as being one of the most effective in the nation. At the time, they said we had an over 280% success rate over the national average. So we were shocked ourselves because we really didn't know much about the field. Like I said, I'm not a social worker and I didn't know much, but I hired people that knew what to do. And we just said, do what you do. We'll cover the cost and tell us what needs to happen. Don, you might remember Skip Land.
Oh, yeah.
Okay, so we hired Skip Land, and to him it was a dream come true. So we were making each other's dreams come true. So anyway, he became our first chief operating officer, and he was someone that was really respected in the field, and we trusted him and just supported his efforts every step of the way. But we realized that now that we had this study, we could probably go to some funders. And we actually went to the state of Illinois and designed one of the first residential reentry programs. So we said, if most of the people that we serve are coming out of prison anyway, why don't we help them right away? Let's do a sit down so that instead of having them released to the community, we would take them at a safe haven. So today, they're calling it a brand new idea, but like you said, Don, it wasn't a new idea. We've been doing that since 1999. Right. So gratefully, we are with COVID, we have a model that helps people live in a place that provides them semi-private accommodations. We never had a model that provided congregate dense type living arrangements. So what happened when COVID hit and the homeless organizations started to get concerned about this issue, the first thing homeless organizations had to do is we had to decompress. We had to reduce the number of people that were staying in homeless shelters from 100 to So thankfully, because AC even has semi-private rooms, we didn't have to decompress. So our main headquarters, which has 400 people, just because of the way we're set up, they have semi-private rooms, they're naturally decompressed automatically because we don't have them that close, right? So that was good. And then ASAP Haven, we've always been very concerned about infection control issues. So we've always, during flu season, had really strict policies about cleanliness, hand sanitizers, checking people when they come in. So thankfully, we were able to just look at what CDC's recommendations were. And believe it or not, we started preparing for COVID back in January 31st. That was because when the president canceled the travel between the U.S. and China, I immediately thought, hey, wait a minute, there's a lot of people in encampments near Chinatown. So let's look at what are we doing to make sure we're checking people that are coming from those types of situations to prevent COVID from hitting our space. So by the time March rolled around, we had already made huge, you know, improvements throughout our system to address it. And then finally, one of the things that really saved us is that we knew that COVID was going to affect the homeless harder than anybody else,
Right.
because we had all the pre-existing conditions, right? We had respiratory issues, we had immune issues, we had nutrition issues, and studies show that homeless have a 12 times higher chance of dying from it. So we stepped up right away and decided that we need to set up a place for people that are homeless, that are COVID positive, to come to get the health care that they need, to get the behavioral health care that they need. And we were able to reach out to Rush and open up the city's first, and I believe only right now, medical respite for homeless that are COVID positive. And we set it up for 100 people right away that were able to come in and get a separate isolation space from the rest of our facility, hospital grade type of situation with negative air systems and things like that to protect anybody from getting it throughout our system. And we're really proud to say that since we opened it on April 11th, which was about a month after we started talking about it, which was in record time in our city, and we were able to now help over 200 homeless people that have been referred to us from other homeless facilities, from hospitals. And I am praising God right now that we have not had anybody die, and we've had 100% survival rate. And the best part too is that while they're there, they're getting their healthcare needs met, they're getting their behavioral healthcare needs, but they're also getting discharged to a place that's going to be appropriate for them to get to that next level of care. Because you can't put people on the street. You have to put them into a setting that's going to get them, the type of help that they ultimately need, short and long term. So we've got some success stories now of people that have gone on to move into supportive housing, affordable housing, senior housing, veteran housing. And I believe that is truly a model that's going to inform all of us to think about not only how do we deal with the homeless when they show up to an emergency room COVID positive, but also what do we do with the homeless that are showing up to the emergency room that are overdosing and from opiates. So that's the next step, I think, in terms of where we can go from here. And I believe between what's happening here in our city with all the organizations and what we're doing, we have all the pieces that we need to make a real difference. But what we need is to really think strategically as a city and as a state to how do we take this mosaic and connect the dots so that when someone's in crisis, we're not sending them all over town, but we're actually identifying the root causes and getting them to the right place immediately. Time is money, and I believe their time matters. And I believe all lives, that are in crisis deserve the right place to go to. And, there's a lot of places that people come to us and, we're not the right place for them. So we need to know that there's places out there that are the right places for them and vice versa.
Right.
That's how we deal with it.
That was definitely a good point of having the resources and being able to point people in the right direction. How do we get that information out? How do we share that so that people know that what resources are available? Like what advice would you give to anyone that's watching us in the community? Any other organization, because that's always a struggle. It's always
it really is.
And you probably don't have the answer, but we're just not aware of the resources that are available.
Yeah. Well, let me just chime in a bit, and first of all, let me just say ditto to everything that Neli just responded to and commented on. It's those types of innovations that are constantly necessary for us to come up with. We should never think that the situation is hopeless. We should always be focused on where is the strategic opportunity, regardless of what the threat is. Because we're only here because somebody didn't give up. It's the only reason why we're here. I mean, somebody kept charging, somebody kept trying. Someone said that there will be a tomorrow. So with that kind of energy, with that kind of focus, intent, with that kind of righteous intent, we always know that tomorrow is going to be possible. So again, Nelly, I applaud you for your innovations and your constant servant leadership. It's fantastic. How do you communicate what's going on? Let me just use the most recent example of what we've been able to do with the Counting on Chicago Coalition 2020. I've got to compliment the governor who allocated over $29 million to Illinois, to ensure that hard to count folk, non-responsive community areas, census tracts, that they were touched in some way to understand once again the basic premise that, you do count, you do matter. We need you to be a part of this count because we need these federal resources in the state of Illinois. So, when COVID-19 hit, guess what? Our ground game got interrupted significantly. No longer were we able to get out there and do the level of outreach and engagement that we initiated. As a result, we sound like we're getting a little feedback. Okay. So as a result, we moved into a virtual outreach and engagement campaign, and the social media impact has been absolutely fantastic. If you visit our website, countingonchicagocoalition.org, you'll see all the wonderful social media outlets that we've been able to tap into. For example, when the NBA All-Star weekend was here in Chicago this past February, we knew that all of our children and families weren't going to be able to get to the United Center to witness all those festivities. So we had a 20-foot screen set up at Collins High School and had hundreds of children's families to come out and look at this, sporting competition. But not only that, we had current Bulls members and players and former Bulls players and NBA players coming out, signing autographs. We had 3-point competitions. We, of course, promoted the census, and everybody got information about the census. And some folks were signing up and participating on site that day. But of course, social media was the key and getting the word out in that particular way. Let me also just mention this, because this is so critical. When we think about the impact of COVID-19 and all the different populations, the homeless, people with disabilities, people with mental illness, people with substance use disorders, all those populations of folk that were impacted, there's one population that we really haven't heard a whole lot about, that I've tried my very best to continue to lift up as a population of folk that still need more attention. And that is the population of folks with developmental disabilities. We had over 80 plus people that we were serving on a daily basis in our day services program, commonly called the Sheltered Workshop, who now have to shelter in place in their homes. Now think about it. These are parents, much like the parents of Chicago public school students, who were accustomed to their loved ones with disabilities going to this sheltered work center every day, minimally for 5 hours a day. Now they are having to be at home constantly. What at the beginning of the pandemic, of course, we weren't able to get appropriate supplies of PPEs. Some folks could not, of course, be able to get to the store, so they weren't getting appropriate food, and so on down the line. So people were going through some very, very desperate situations. And as a result of that, we had to come up with ways and means to reach the people, communicate with folks, and make sure that they knew that these services were out here. So what do? We use that vehicle of the census to make sure that people are not only being counted, but we also engage in social determinants of health screening to make sure that people's basic human needs were being met. I'm not sure if our host is still with us. It looks like her picture faded. I'm not sure we're still live or what.
You're good, Don. I think she's just in the background.
Okay, all right, real good. I'm so accustomed to seeing the host always present there. So people with disabilities, also our seniors. We have 2 senior facilities, 60-unit senior facilities. And naturally, I'm very concerned about their health and welfare. So we have to work with our property management company to ensure that the seniors were getting the resources that they need. Their shopping done. What about their pharmaceutical needs, and so on down the line. All of these concerns were, really being put on center stage. And then of course we've got children. We for years have been running early intervention for children of incarcerated parents program, restorative justice programs, child welfare related programs. But what about these kids who are now at home? What do they get? What additional supports do they get? So, how do you communicate that? We make sure through social media, through a lot of different virtual formats, that we continue to communicate with folks, and now reaching out to folks on yet another level. And of course, that is the churches. We've done census Sundays, and, we've reached out to our elected officials, and, we joined our elected officials when they're giving out the face masks and the food and so on down the line, that we're out there giving out information about vital human services and, of course, the census information as well. So any and every opportunity we get, we make sure that the word is passed on.
As far as getting the word out, we really, Yolanda, I just want to let you know, at A Safe Haven, we don't spend money on advertising. I don't know anybody who really has a lot of money to go out there and advertise their shelters. But, we are always full, so as you can imagine, the demand, for the types of services we offer, even before COVID, we were already at A Safe Haven turning away about 1,000 people a month. And it was heartbreaking because of the fact that, people are making a decision to get help. And we just don't have the capacity and the resources to meet the demand. And I am very concerned about what the pandemic is going to do in terms of the aftermath. We have yet to feel, the wreckage that is going to occur financially to so many people that were at the bubble. So we already knew, studies had already shown, nationally, locally, 40% of the people in our city, our state, and our country were living literally one paycheck away from being homeless, right? The only reason we haven't had a reckoning moment with that is because we've had support. We had $1,200, right? We had $600 increases in unemployment benefits, that are about to run out. And we've had moratoriums on evictions, so I feel that, we are doing everything we can at A Safe Haven to make sure that, while the governor, while the mayor are thinking about their response to COVID, that they think about the critical infrastructure, including homeless organizations, including, the need for more capacity. Because remember how I just described how these homeless shelters had to decompress? Well, guess what? They opened up emergency beds at hotels, and they opened up emergency beds at, community centers like the YMCA. So that is where these people went from these homeless shelters. But eventually the YMCA is going to go back to business. Eventually these hotels are going to go back to business. But there is no plan right now to replace those beds. So we're going to be about 700 beds less after COVID than we even had before. So I believe that while the governor and the mayor are really thinking about strategically about how to invest those CARES Act dollars, really think about the landscape of who's out there doing this work, who's really doing it well and is able to really withstand, the pressures of the economic winds, that happen, in every budget, whether it's a state, federal, city, where unfortunately, since the recession, homeless, budgets have really gone down dramatically with human service budgets, oh my God, so we've had to make things work with less resources at a time when demand is skyrocketing. So I'm grateful for that Notable Hero Award that Cranes gave us, because I've always said homelessness is a public health issue.
Right.
We should be included as first responders, as essential workers, as healthcare heroes too. I believe your team is doing the heroic work from what you just described, when most people are hiding out in their apartments and their homes. People are out there on the front lines doing the work that needs to be done to protect the people, to protect.
Yeah. Neli, you there?
I think we lost her.
Yeah, it looked like she froze there for a moment. But as Nelly was talking, again, it's about realizing that we all of us we also have essential workers, and we have not at Cooperative Systems we have not closed one day. There's just one program. That's
Really?
program
Wow.
that I mentioned serving people with disabilities that has been interrupted, but we've got 15 different locations. So we're still serving, several persons with mental wellness who are challenged in that way, and about 5 or 6 of our group home facilities. We're still operating our recovery home. We're still operating our halfway house. We've got over 200 beds, that we have filled on a regular basis, with folks suffering from these challenges and conditions. The other thing that Nelly had referenced that I wanted to, again, revisit was the notion of the ongoing impact of this pandemic. Okay, now let's look at it. People are always talking about PTSD, post-traumatic stress disorder. We know that because of the violence and the constant trauma within our communities, that there's no post to the trauma. It's a present trauma. It's constantly going on, and a lot of folks, have now been exacerbated their conditions because of this pandemic. It's real. Can you imagine a person who's been diagnosed with a mental illness or who has been challenged with drug addiction, dealing with the additional stressor of this pandemic? That's very real. That's a hallucinatory event in their thinking. That is real. It's a real threat. And that, at this point in time, it's not only affecting them, but everybody that they know. So you've got folks who are, becoming depressed, experiencing anxiety, becoming paranoid, who have not been certifiably diagnosed. So the population of folks who could potentially come into systems of care has increased. We've been hearing increasingly about first responders committing suicide, about adolescents, kids committing suicide. I mean, the stress and anxiety and the desperation of folks is at an all-time high. So,
Right.
This is not a time for us to turn the other way. I mean, I too, Nelly have been appealing to the governor, to our county board president, to our mayor, to put the same energy and effort behind, the need for behavioral health services and the types of services that we're discussing here this evening that we have to the pandemic response. Because I have applauded the governor, the mayor for, what they have done, within the city, within the state, to lead the nation in terms of innovation in response to the pandemic. I think it's fabulous. It's just that we need to continue this effort. We saw what happened, back in 1990 with the passage of the American with Disabilities Act, that everybody got on board with that. And, the city of Chicago became one of the most accessible cities in the nation, simply because all the city services rallied around, the need for people with disabilities to have access, to get rid of employment discrimination, architectural barriers, you name it. The doors will really open. Now, have we gone as far as we need to go with that effort? No, we need to go further. But clearly, when there is a concerted, generated effort to make some change happen with whatever the systemic issue is, in fact, we can see the change happen.
So, Don, you and I need to follow up on this conversation because I see some places where we can align, and be a united front on this behavioral health care, situation. I don't know if you're familiar with the 1115 waiver, but I actually served on the Medicaid Advisory Committee. And that was really, I believe, a holy grail, in terms of an opportunity to really connect Medicaid, to cover the cost of, the aftercare for a lot of people that are being diagnosed and cycling in and out of the system. That's costing Medicaid. Behavioral health care counts for 56% of the Medicaid cost. And that's crazy because the people that are diagnosed with behavioral health care issues are only 25% of the people that are in the system. So it's clearly disproportionately spending too much money on behavioral health care because we're using the most expensive type of care as opposed to doing what we just described with the COVID and saying, let's identify what's going on and let's discharge them to a level of care that's going to be appropriate, connecting them with the right health care and the right behavioral health care services. And after that, get them to education, treatment, job training, whatever it is that they need. Everyone's different. And, we too have about 40 real estate developments throughout the Chicagoland area providing different levels of care and 1,400 people within our system on any given day. And I want to just say, that my team, they showed up. they didn't just show up, but they went above and beyond and protected the people that we serve, because out of all the people that we had throughout our system so far, thank God we've only had 4 people diagnosed. We caught them immediately. That we've had no outbreaks. And thank God we've had no staff infected so far. But we had to fight tooth and nail to get those medical supplies because we didn't qualify. And I don't know if you did, Don, but we didn't qualify. So we had to find money to go out and buy our own as fast as we could. And, where hospitals got all the PPEs and the medical supplies, again, homeless programs are not considered part of the critical infrastructure. So there was no reason for them to even have us on the list of priorities. But, hopefully after COVID, and the pandemic has made it crystal clear to everybody that homelessness is a public health issue. So now we're finally talking about this issue in the right category of where it needs to be, but now we got to back it up with the insurance coverage, to make sure that we should not be at the mercy of budgets coming and going. We should be, if someone is sick and they have a behavioral health care issue or a subspace issue, we should automatically be able to help them, barring whatever reason, other reasons that may be going on in their lives. Because right now we've got to find out, do they fit a bucket? Are they a woman with children with, a criminal justice background? And do they, in order, domestic violence, so you got to find the right money, and I don't believe that should be the way we deal with things. We should just say, look, you clearly have a diagnosis, let's get you assessed on other social determinants of health. Let's get you to the right place, that's going to help you. So, Yolanda, what you're doing right now is very, very appreciate being invited to be a part of this conversation. I know that, Don and I are going to take this further because of you and Don Doty having this vision and obviously having Doty Comprehensive part of it, and let's keep it going. But, having these types of conversations helps educate your audiences, our audiences, Don's audiences, to learn more, because this is not going to come from the top down. It's really got to come from the groundswell of the people, really coming together and saying, this is what we need, in our communities, and we want to see supported, because day in and day out, they know that they can count on, the frontline workers and the frontline organizations to be there no matter what is going on in the world. And the world is crashing down, but we're standing here in solidarity as long as we can hold on to continue to do the work that needs to be done. And I know I'm not going anywhere. So thank God, we're blessed with good health and good people around us and good supporters. And Don is too. You said you got another 20 years. So I heard that. So let me know.
Tim Black is 101, so he's got a few more out there too. He's like, don't stop.
Yeah. So I want to thank the both of you for being on the show. I definitely want to commend and celebrate Georgia Doty Comprehensive Health Organization and Don Doty, his board, for even allowing this platform to take place. We have just a couple of minutes, and I always like to end the show with asking the guests to give some final words. And for me, when I think about everything that you guys have talked about and everything that we know our community, our city, our world is going through, and I think Donald, you mentioned it about, there's no hope, we have to have hope. So I want to ask each of you to just share some final thoughts, some final words, of inspiration, something that will be encouraging and empowering, and anything that the viewers could find out how they could possibly get involved in something that you guys are doing. So we'll start with you, Neli.
Okay. Well, I hope that this conversation, gave the viewers a little bit of hope, and knowing that while a lot of negativity, hits the news every day, there are a lot of really good things happening, right here in our city. And, lives are being transformed. People are achieving, dreams that they never thought possible after getting help from either Donald's organization, our organization, Yolanda's organization, the other Donald Doty's organization. We're here for you. So although we don't have the money and the bandwidth to get the advertising out there, we rely on your word of mouth, to get the word out to anybody that may need our services. You can contact A Safe Haven by going to our website, asafehaven.org. You can call our phone number, 773-435-8300. If you need help, if you know someone else that needs help, or if you want to get involved and be a part of what we're doing, let us know. We're always looking for talent. We're looking for people that want to be a part of something bigger than all of us. And by the way, every year A Safe Haven hosts a 10K run to end homelessness. And I'm a big believer that, physical fitness and mental fitness go hand in hand. So about 10 years ago, I do runs, I do 5Ks, I do 10Ks, I've done a few marathons, and that's how Neli gets her therapy, right? So that's what makes me, have the strength, and the presence of mind to focus on what I need to focus on. And I thought, let me introduce this to some people in the community. Let me introduce this to the people that we serve. And so I decided we're going to bring a 5K run to end homelessness to Douglas Park. So I started doing it 10 years ago, and it became really popular and it got really big. So I moved it over to Montrose Harbor. And this year, by the way, we can't do it because of COVID.
Right.
So, it's funny how God works, right? So I'm determined to have this event no matter what, because knowing that what I know with the tsunami that we're going to have of homeless people needing help, and that we're finally having this conversation about it being a public health issue, we can't let this conversation get away from us. So I am hosting the inaugural global virtual run walk to end homelessness. And we've already got people from Taiwan, we've got people from Ireland, we've got people from Mexico, we got people from Chicago signing up to be a part of this. We're already breaking a record with the amount of money that we've raised ahead of time, and we're breaking a record with the number of teams that are being formed to support this event. And you can actually sign up online, download an app. The app will be able to track your steps. The minute you walk out your front door, you can start walking. It'll tell you if you ran a 5K, a 10K, or walked a 5K, 10K. And, I'm just so excited. It's going to be going on for a whole week, July 18th to July 26th. We're going to have opening ceremonies on Facebook Live, and we're going to have closing ceremonies where we're going to be able to feature, some of the people around the world that participated. And even during the event, people are going to be able to upload pictures and shout outs and, things that they want to say about why they got involved to end homelessness. But, we don't have a corner on the market of homelessness right here in Chicago. It's happening everywhere in the world. So I'm excited about having a way to unite the world around this topic. And I invite you, Don, and, Yolanda, to start up a team for your organizations and invite your people to be part of it. I think for 1 week, if we can all get together and just say, let's do this and let's put a spotlight on it, and let's, let us introduce people to you too through our networks. I think that, at the end of the walk, and the end of the run, at the end of that week, we're going to talk to millions of people around the world about this topic that didn't even know much about it and didn't even know, there was a way they could be a part of it. So from there, I hope that the universe takes over and, people start to get inspired and start to do whatever they want to do to be a part of it. So hopefully you'll join us. The run has its own website. It's runtoendhomelessness.org. And visit our website, A Safe Haven. You'll get a link to it. And that's what I have to say. So hope it's not the last time we're on your show. We get invited back, and we get to celebrate some of the great things that happened as a result of your invitation today. So thank you so much, Yolanda.
Thank you. And what, Mr. Do, your final words?
Well, first of all, I think that it's just so important that we pay attention to an old proven proverb that says, "He who has health has hope, and he who has hope has everything." Martin Luther King's last book talked about why we can't wait, and he continually talked about the importance of lifting up civil rights. He continued to talk about the importance of hope, and he of course realized that economics was key in terms of the next frontier of the struggle. So what I want to encourage everybody to do is to remember that you really dictate the terms of your life. Many of the persons we have worked with in recovery, they of course embrace the 12 steps. And many will say it's one day at a time. Well, I submit something slightly different. I say it's really only one moment. And one moment of life, you can make a choice that can make you a victim or victorious. Choose victory in this moment of life. Choose
Amen.
victory. Make sure that the story, make sure that
I
the
love it.
has a happy ending, okay? And also, let me leave our number, 773-261-2252, if you want any services provided by HSI, or our website, www.habilitative.org. Thank you so much for hosting us tonight, and thank you, Don Doty.
Thank you, thank you, thank you, thank you. I will, for those that are watching, we didn't get a chance to do questions, but I will be posting and promoting these phenomenal guests that we had and their organization and things they have, the services they provide, as well as what's up and coming for them. So you can find me on Facebook, Yolanda Givens. You can look for the Georgia Doty Facebook page as well. Thank you, thank you, thank you so much. I'm excited. We just launched our 6th season of the Doty Report. I will be back next Tuesday at 7:30. Hopefully, get this platform all figured out. I appreciate both of you. I am definitely inspired by both of you, and I look forward to meeting you guys in person.
Can't wait. Take care, everybody.
All right,
Thank you. Have a good one.
Okay,
Great night. Bye.